Welcome back to the Doctor series. Today I'm going to talk about a very delicate topic that may be close at home for many of you, and that is called the topic of DNAR or DNACPR. So you may have recently been diagnosed with a long-term condition or a terminal illness, and your doctor may have discussed with you about DNAR and resuscitation and asked you to go away and have a think about what you would like to do. Now you've probably got 100 different questions. The first one being, what is DNAR and what does it mean? Well, that's what I'm here to explain. So what is a DNAR? A DNAR is a form that is signed by a medical professional following discussion with a medical team that says this person would not be suitable for resuscitation. Now the first thing to appreciate is, what is resuscitation? So resuscitation refers only to CPR and efforts to keep the heart going when it's otherwise going to fail, or restart the heart into an appropriate rhythm when it has fallen into a rhythm that is not sustainable for life. It also refers to pulmonary or lung support, so placing patients on ventilation to make them breathe when they otherwise would not breathe. This is all CPR refers to. It's the action of cardiac compressions, shocks to force the heart back into a suitable rhythm to sustain life, or things like intubation and ventilation. Resuscitation does not in any way refer to ongoing care with treatment with things such as antibiotics for infections, IV fluids for dehydration, or treating pain or any other symptom of disease. Now, anyone who hasn't had a DNAR form signed, so that's the majority of the population, are automatically for CPR. So that means if you were to come into hospital and your heart were in an abnormal rhythm or you weren't breathing, the medical professionals would start cardiac compressions, would be prepared to defibrillate you, use intravenous medications such as adrenaline to get your heart back into rhythm, and may consider taking you to ITU for ventilatory support. And this is when a DNAR form comes into play. So there are many conditions where a person may be suffering from where it may be deemed by medical care professionals that CPR would not be in your best interest. And that could be for several reasons. The most common is that CPR would likely to be unsuccessful, or that it would leave you, if it is successful, in a worse state than when you started. And as you can imagine, having a lot of people jumping up and down on your chest at the very least is going to cause severe pain, bruising, fractured ribs. It may cause puncture to the lungs and a variety of other symptoms. Of course, during that period of time, your brain is starved of oxygen and you may develop stroke or infarct leading to brain damage. Going on from that, you could also develop a heart attack due to a lack of oxygen, or death of muscle or body tissue. And as you can imagine, if you may come around from that, you'd then be in a worse off state. Now, typically a DNAR decision is a medical decision made by your doctor in your best interest. However, that's not to say you can't have a preference. And the way to think about it is, if I was approaching the end of my life, would I prefer to have a natural, peaceful death and be allowed to pass away as nature intended, or would I want people to make efforts to restore me to a state viable for life using cardiac compressions, defibrillation, and intubation and ventilation, which can be a very traumatic experience? Now, a DNAR decision is of course a very important decision, and though typically it is made by the medical team, they do like to involve you in the process and should discuss it with you. So to summarise, a DNAR CPR refers only to the act of resuscitation. And if you have one signed and on your file, it means that no one will attempt to resuscitate you using defibrillation or cardiac compressions. However, under no circumstances will it affect your medical ongoing care. So for example, if you were ill in hospital and you developed an infection, we would absolutely treat you with antibiotics. If you developed dehydration, we would treat you with IV fluids. If you had severe pain or any other symptoms, we would treat those with relevant painkillers or whatever else was necessary, just as we would for any other patient. Having a DNAR form signed on your file does not affect your medical care. All it pertains to is your decision about whether or not you would be suitable for CPR if your heart were to stop working. Now, I hope that's helped to clarify things, and if you've got any further questions, post in the description below and I'll be happy to answer them. Now, if you liked what we talked about today and you found it useful, then give us a like and hit the subscribe button to be privy to more free medical and life information. Yours, Aman Sandhu. Thank you very much.